a break or not? I will not take so long. 10 minutes only. Okay, 10 to 15 minutes only. You want to take break or not?
I think we can proceed.
So it will not take too long, only 15 minutes. So today's revision is CVS and respiration. So we will start with the, wait, no, I will reply Dr. Brady. I will reply Dr. Brady first. Okay, so we will start with the CVS. No? So for the CVS, you have to open the question 4. You have to open the circulation of the heart. You open the circulation of the heart and wait for me now. I am checking. So circulation of the heart, you have to know the right and left coronary artery and branches. No, right and left coronary artery and branches. So I will tell you the slide number. So you open the circulation of the heart and see the slide number. I wonder whether same slide number 12, arterial supply of the heart. So as a medical doctor, no, you must know the arterial supply of the heart. No? So in the arterial supply of the heart, you must know the right and left coronary artery. No? Right and left coronary artery. So slide 12, no? Coronary artery, they are right. So you need to know the origin. No? They are arise from the aortic sinus. No? Slide number 12, no, they arise from the aortic sinus, no, and then there are right and left coronary artery, and we will talk about the right coronary artery. So sometimes what happens is that if there is a candidate for distinction or borderline, no, you may have to get the Bible voice or interview, and we usually ask about this, no. So what are the arteries supplying the heart? Then you have to answer the right and left coronary artery. Then you have to explain about each artery. No, so right coronary artery arises from the right aortic sinus, and then near the origin. So go to the slide 30. Near the origin, it gives off the SA nodal branch, which supply the SA node. Then in the slide 14, it gives off the right marginal branch. So generally, right coronary artery supply the right atrium and right ventricle. No? Then main right coronary artery curve posteriorly and give off the posterior interventricular artery. No, give off the posterior interventricular artery. This posterior interventricular artery anastomosed with, you can see in the diagram, anterior interventricular branch of the left coronary artery. No? Posterior and interventricular artery anastomosed with the anterior interventricular branch of the left coronary artery. Okay, next slide. Slide 16, dominance. No? Dominance of the coronary artery is whether right dominance or left dominance depend on the coronary artery system by which artery give rise to posterior interventricular branch. No? So for example, you see the diagram right dominance. Right dominance means posterior interventricular branch arise from right coronary artery. This is called the right dominance. So in the right dominance individual, if the right coronary artery is blocked, no, the effect is more severe. Left dominance means posterior interventricular artery arise from the circumflex branch of the left coronary artery. No? So this is the right coronary artery dominance and left coronary artery dominance. And then generally right coronary artery supply, you can see the next slide, slide 17. No? Yellow area, right atrium, no? Right ventricle, so on. No? So you must know the right coronary artery. Left coronary artery is, next slide, slide 18. It arises from the left aortic sinus and it gives off the two branches. In the diagram, you see anterior interventricular artery and circumflex artery. No? So these are the branches of the left coronary artery, and now we will go to venous drainage. No? Venous drainage is mainly from all the venous blood from the heart drain to the coronary sinus, and coronary sinus open into the right atrium. No? Coronary sinus, so there are tributaries that drains into the coronary sinus called the great, middle, and small cardiac vein. Okay, so this is the venous drainage of the heart. Now, wait for me. I will continue this. So you have to know the coronary arteries, no? Coronary arteries. And then for the graph, no? For the graph. So let's see the slide number. We will see the slide number 32. In the coronary artery bypass graph, no, we will use you see the diagram, either internal thoracic artery or saphenous vein, no, to replace the narrow part. No? So this is called the coronary artery bypass graph. We will use either internal thoracic artery or saphenous vein. Okay, this is about the coronary artery bypass graph. Okay, so that's all for this circulation. Okay, now we will go to the fetal circulation slide. So the PowerPoint. So we'll close this one and open the fetal circulation. Fetal circulation PowerPoint. I don't know why I can't see my PowerPoint. So I cannot see my PowerPoint, but what you have to do is you open the PowerPoint and see the derivatives of the remnants, no? Remnant fetal structure and adult structure, no? I don't know which slide number. Wait for me, no? To open it again, fetal circulation. Fetal circulation, slide number 13. Slide number 13, no? So you have to know the derivatives, no? For example, umbilical vein, no? Umbilical vein form the which structure, no? So you have to know this umbilical vein. So right umbilical vein regress, no? Left umbilical form the round ligament of Levar or ligamentum teres, no? And then one more thing you have to know is what is the datus venosus, no? Datus venosus. So let's see what is datus venosus. Wait, no, datus venosus is the, wait, no, I will show you the slide number. I am a bit slow because my computer. Okay. Okay. So please see the slide number 8. What is a datus arteriosus? No, datus arteriosus is the passage that connect the aorta and pulmonary artery. So you see the diagram, and you can see the diagram that the arteriosus, it is a passage that connect the aorta and pulmonary artery. I think that's all for the CBS. No, I will check again. So, and then one more thing, you have to see the foramen ovale. No, what is a foramen ovale? Foramen ovale is a structure. It is situated between the right and left atrium. No, so I will show you the slide. I will tell you the slide number. So slide number 11. No, there are two foramen. No, in the septum primary and septum secundum, they form the foramen and headbutt. No, when pressure in the left atrium increase, no, the septum primary and septum secundum press against each other, and interatrial septum is formed. No, so there is a closure of the foramen ovale. No, so the opening between the right atrium and left atrium, we call it the foramen ovale. No, foramen ovale is a opening, it's a passage between right atrium and left atrium. No, okay. I think that's all for the CBS. I think you all know the chest pain, angina pectoris, no? But I don't mention now. Okay, so that's all for the CBS. Any question? Any question from the student regarding this CBS? If no question, I will go to respiration. No, I will go to respiration portion. Respiration portion is less than the. So the one thing it will be difficult for you is the diaphragm, no respiratory portion. So you open the respiration and then go to, I think in the practical section, there is a diaphragm, no? Diaphragm and the trachea bronchial tree. Do you find this PowerPoint diaphragm? I don't find it in my folder. Do you have this? Diaphragm practical. Diaphragm, do you have this? Please respond me. Go to the VLE. Wait, no. We'll go to VLE. Respiration. Glucose. Anatomy of diaphragm. Do you find this? Answer me, please. Anatomy of diaphragm. Hello, hello. Can you hear me? Anyone? Do you see the anatomy of the diaphragm? Why no response? Can you hear me?
Yes.
Do
Yes.
you,
Yes.
do you see the anatomy of diaphragm in practical section? Can see or not?
No.
No.
Can see or not?
No.
Oh.
No.
No. I can open it. Wait for me now. So cannot open it. I also see URL only. Okay, never mind. I will show you. But you must have this right. Let's try. Wait for me. Respiration 2025. The diaphragm and tracheobronchial tree. I know. I think it is somewhere in there. Let's try. Never mind. So you remind me, no, to give the anatomy of diaphragm lecture. No, I will update here, and then next section, no, next revision, I will combine this. No, so there are two parts in the diaphragm. No, Okay, never mind. I better give the PowerPoint first. Okay, next we will go to the tracheobronchial tree. No, we will go to tracheobronchial tree. So you open the trachea lecture. No, you open the trachea lecture. Why I can't find the diaphragm? No step. So open the trachea, bronchi, lens, and pleura. Okay, and open and then see the trachea. Sorry, no, my computer is slow now. So you see, you open the slide trachea, no? Trachea begins at the C6, no? Ends at the sternal angle. That is a junction between T4 and T5, and nerve supply is running nerve, no? And then you also have to remember the right and left main bronchi, no? So right is most likely to get the right bronchi is more likely to receive the foreign body because it is shorter, wider, and vertical. No? So uh, I will show the slide. I will tell you the slide number to study the trachea. So slide number 4. No? So trachea began as the C6, no, at the level of the sixes and end by dividing into right and left primary bronchi at the level of the T4. No, it has 16 to 20 C-shaped hyaline cartilage and they are open posteriorly. No? This posterior end is closed by the trachealis muscle. So began at C6 and at T4. And then there are two bronchi, no? Right main bronchus and left main bronchus. So slide number 6. No? There are two right and left main bronchus. No? And then they divide into secondary and tertiary bronchi and see the slide number 8. Right bronchus is shorter, wider, and less oblique. So that see the last sentence, foreign bodies entering the trachea are likely to enter the right lung via the right main bronchus. Okay, so this is for the tracheobronchial tree. The most important thing is trachea. And then another thing I want to show you is the lingula. No? So let's see the lingula. Where is the lingula? So please see the slide number 14. So right lung and left lung, no? So right lung is larger and wider and it has 3 lobes separated by the 2 fascia, horizontal and oblique. Left lung has only 1 fascia, oblique fascia, so it has 2 lobes. You can see the cardiac notch, no? You can see the cardiac notch in the left lung Wait, no, I am searching the cardiac notch. Maybe that it is not labeled. Cardiac notch is the notch in the left upper lobe, and then you can see the below the cardiac notch to below the cardiac notch, you can see the tongue-like structure called the lingula. So lingula is part of the which lobe of the lung? Lingula is part of the which lobe of the lung? Answer me. Purple one. Lingula
Upper,
is
left
upper,
upper.
left upper lobe. No, so you have to answer the left upper lobe. No, okay. So next thing is I would like to mention about the bronchopulmonary segment. No, last one, my bronchopulmonary segment. So go to the slide number 17. No, so you can see the structure called the bronchopulmonary segment. They are the independent structure, and it is in pyramidal in shape, and apex is this. No, apex is towards the hilum. No, they are called the bronchopulmonary segment. Slide 17. Go to slide 18. So it has a pulmonary blood supply, lymphatic and nerve. No, and then they are separated from each other by the pulmonary vein. No, so pulmonary vein are shown with the blue color. No, so each segments are divided by the pulmonary veins. No, so if any lesion in this region, we can remove the bronchopulmonary segment, no, by segmentally. No, so for this one, you have to see the clinical importance. So slide number 10. Pulmonary disorder may be localized or confined to the PP segment. No, so surgical removal of the segment is possible. No, so that BB segments are the has its own blood supply, lymphatic drainage, and nerve supply, and pulmonary veins are situated in between the segment. No? So if there is a lesion, such as carcinoma, we can remove the segmentally. No? Each segment we can remove the bronchopulmonary segment. No? So that's all for my revision for the respiration, and I upload the diaphragm, no, in the respiratory module again, and please remind me to give revision on this, no, in the next, when is the next anatomy revision? When?
Thursday.
Thursday, what time?
10 to
10:30. Okay, okay. We will discuss later because we all have the workshop. But anyway, I will give the revision, and that day I will include the diaphragm. No, diaphragm is important. No, important for the exam. So I will teach again and I will explain you. No, so I will end the section here. And this is a revision from my lecture for CVS and respiratory module. Any question on this? So if no question, we will end the section here and see you again in next revision section. All the best and study hard. No, now you know that there are many to study. So you have to study hard and focus on the revision. Okay, I wish you all the best, and that's all for today. No, have a nice day.
Thank you,
Okay.
doctor.
Thank you.
Thank you, doctor.
Thank you,
Okay,
doctor.
welcome. All the
Thank you,
best.
doctor.